How long does recovery from cerebral infarction typically take? When it comes to recovering from a cerebral infarction, which is a type of ischemic stroke caused by a blockage of blood flow to the brain, the timeline can vary quite a bit. Factors like the severity of the stroke, the age of the patient, and how quickly treatment is received all play a role in recovery. Generally, most people see significant functional recovery within the first 3 months after the stroke. Improvements can continue for up to 6 months and sometimes even longer. In the initial phase, which spans the first days to weeks after the stroke, the focus is on stabilizing the patient and restoring blood flow if possible. Rehabilitation usually kicks off within 24 hours after the stroke to help maximize recovery potential. This early intervention is crucial. During the first 3 months, a critical period for recovery, studies suggest that between 48% and 91% of recovery in neurological impairments and functional abilities occurs. This includes improvements in motor skills, sensory function, cognition, daily living activities, and gait. The most rapid recovery often happens within the first 4 weeks after rehabilitation begins, but it gradually slows down as time goes on, continuing until about 3 months post-stroke. Recovery does not stop at 3 months, though. Up to 6 months, patients can still see improvements, especially in many functions. However, some aspects like leg motor function may take longer to show progress. Looking at long-term recovery, while most gains happen within the first 6 months, some individuals may continue to improve for a year or more. This ongoing progress is often linked to the intensity of rehabilitation and therapy. The initial severity of the stroke and the patient's health before the stroke also play a significant role in determining long-term outcomes. Typically, after a stroke, the hospital stay lasts about 5 to 7 days. During this time, a stroke care team assesses the patient's condition and begins rehabilitation. Early and intensive rehabilitation is key to optimizing recovery outcomes. Survival rates and functional recovery can also differ based on the type of stroke and individual patient factors. Generally, patients with ischemic strokes have better early survival rates compared to those with hemorrhagic strokes, which can influence recovery opportunities. In summary, recovery from a cerebral infarction is a dynamic process. The most substantial improvements usually occur within the first 3 months, with continued progress up to 6 months and potential for further improvement thereafter. Early intervention and rehabilitation are essential for maximizing functional recovery. Since recovery timelines can vary significantly from person to person, personalized medical care and ongoing assessments are vital. Always consult healthcare professionals for tailored advice and support during recovery.